thank you, ECH Alliance, for the invitation. Now, the future's coming home. I just heard it saying by Anna Maikes. So if a lady who was able to stand in front of a panel of investors from whom she did not receive any money because of being a woman, because of having a Spanish accent, or because of the geography where her technology had originated in Barcelona, if she says the future's coming home, the future's coming home. I believe it, right? So me working at a privately owned pharma company, Ferrer, headquartered out of Barcelona, we're a traditional pharma, small, medium-sized. How are we going to make this happen? How are we going to make the future come home? So there's no other way than interacting with technology-based companies who can somehow enhance our products by providing them with a digital layer of service or something similar. So the whole purpose of the Ferrer for Future program that I'm going to present to you today is for Ferrer to perform open innovation and attract startups that can provide solutions to the challenges that we have identified within our business units. Now, how do we do so? So we launch challenges to the ecosystem, to the entrepreneurial ecosystem every year, 2 or 3 challenges. And then we have a number of pitching sessions, and we funnel down those solutions to those that are a best match with Ferrer's core therapeutic areas and core strategy. This year, Ferrer for Future challenges have put a focus in cognitive decline, in mild cognitive impairment. People with mild cognitive impairment, they do have difficulties in focusing on tasks, they are slow responding, and they forget things. And so do I. And so do many people during the normal course of aging. So how do I know whether my signs of cognitive decline are just part of regular aging or normal growing old, or whether I am at the early stages of a track that will take me down to dementia? So there is this continuous spectrum where at one end you do have signs and symptoms that are normal cognitive changes due to age. This is known as cognitive frailty. And at the other end of the spectrum, you have dementia with the severe cognitive impairment. Now today, there is still a need for accurate, accessible, and efficient cognitive screening instruments focused on helping doctors in early stage detection of mild cognitive impairment. So here go our 2 challenges for the Ferrer for Future program 2021. The first one is how can we help doctors diagnose patients who are either at risk or at early stages of mild cognitive impairment without having to perform cumbersome face-to-face cognitive tests. The second one is how can we find personalized, digitally supported rehabilitation for patients that they can self-deliver at home for either improving cognitive or motor functions. We trust and we're fully convinced that if we are able to detect MCI early enough to start treatment early, we can also improve the quality of life of those patients. Thank you very much.
Thank you very much. Thank you very much, Gemma. So we will clean the lectern. We will use the lectern as well? Yep. So Aline, we take the next one. Aline Noizet starts her short bio saying that she is a connector by nature, and I can confirm that. Aline is working as Chief International Officer at the Barcelona Health Hub, but she has plenty of other activities working at Nina Capital, coordinating a community of startups here in Barcelona and elsewhere in the world. She has been in charge of the accelerator program of Bayer as well a few years ago. So many connections across the world in the digital health sector. And today, Aline, you will talk about what is happening in São Paulo, in this wonderful place we have in Barcelona. So please, Aline, the floor is yours.
Thank you, Julien. And good afternoon, everybody. It's a pleasure to be here this afternoon with you to tell you more about Barcelona Health Hub and how together we can make innovation happen. So Barcelona Health Hub, our mission is to accelerate digital transformation in the healthcare sector. And we do that mainly by connecting the different actors of the ecosystem. And today I wanted to tell you more about the project that we're involved in, which is the Barcelona Health Hub 5G design. So we are doing it in collaboration with 5G Barcelona that are over there, if you want to see them. So their mission is actually to equip the city of Barcelona with 5G technology. So there are different labs across the city, and this specific lab is focused on healthcare. So it's located inside Barcelona Health Hub, just below DKV lab. So if you go there, you can see both of them. So the idea, so there's this physical room that you can see here on the picture. So there's 5G phones in the room and other devices. And the whole place is equipped with 5G technology. And the idea of that project is that first for our startups, like all the companies located in Barcelona Health Hub and other healthcare companies, to benefit from the 5G technologies, to implement it to their solution, and to have an impact on the healthcare system. So now I would like to show a short video so you can understand better about that project.
The Barcelona Health Hub 5G design is an open space for companies and startups to co-create new solutions in e-health based on 5G technology.
We aim at bringing huge value with 5G Barcelona members who will leverage the knowledge gained from cutting-edge European R&D projects to transfer and apply it locally and promote value-added initiatives.
Implementing 5G has always been one of our strategic goals, and it fits perfectly in our roadmap to take healthcare to the next level and have a real impact on the healthcare systems.
Health data and advanced data analytics under 5G services and artificial intelligence will help accelerate scientific research, personalized medicine, early diagnosis of diseases, and more effective treatments.
There are multiple applications of 5G in healthcare, and one of the most important ones that makes even more sense in that moment in time is telemedicine.
Es por eso que nos hemos unido a Barcelona Health Hub, dotándolo de cobertura 5G y dándole soporte en el desarrollo de aplicaciones que esperamos puedan mejorar los servicios de telemedicina que prestamos actualmente a nuestros clientes.
We have lots of companies working on telemedicine solutions, AI-based solutions, virtual reality, and those are the kind of technologies that will benefit immensely from 5G.
So as you can see, there are many applications of 5G in healthcare. And one of the most important ones for us is telemedicine. And many of us have experienced telemedicine this past month doing a video consultation with a doctor. And you know how important it is, like the good connection, right? For the video to be clear, for the connection to work. Because if you think about it, like a doctor just seeing you through the camera can actually see if there's an issue with you, maybe just looking at your skin, looking at your eyes. So that's why it's so important. And if you think also about Africa or Latin America, those countries with poor connections, well, 5G can really make a difference here. Another important application is remote monitoring. So we're talking more and more about the care being where the patient is instead of us going to see the doctor. So it means also like collecting our data and sharing those data with the doctor with kind of alert system. So if there's an issue, the doctor can act at the right moment. But for that to happen properly, we need that strong connection. And again, 5G can help. And other applications, as I was saying in the videos, are artificial intelligence, robotics, virtual reality, etc. So what we are doing with the lab is that we want to do workshops with you working on solution digital health. So you can tell us like where do you see the potential, and then we can do a hands-on workshop to together work to apply that technology to your solution. So if you want more information, you can go on our website, barcelonahealthhub.com, and there's a specific section about 5G with more information, and you can also like leave your details, or you can talk to us so we can take that further. Thank you very much.
Thank you. Thank you very much, Aline. Please join the seat. So we are a bit delayed, but we can take a couple of questions if you have about these programs and labs that have been presented. So the message is clearly connect with these three ladies if you're interested in participating in this initiative. They are there to support your innovation, support your development with expert services, expert advice. Do we have questions? Yeah, we have one here and one here.
Hi, thank you very much. I have a question probably for Aline. You were talking a lot about 5G, but 5G is only available right now in big cities, and the places where you actually need better connectivity, you don't have 5G. So I'm just wondering, how big is 5G in your core business model? Is it really that important for the application of the digital transformation, where actually when you have optic fiber, it's thousands of times faster than 5G as it is today. So I'm just wondering how useful really is 5G as for today, or the other parts of your business that you're saying actually have more presence than 5G, and 5G is just maybe a fashion.
You can answer that in 20 seconds.
Yeah. So I think that to answer your question, like 5G, you've got two types of 5G. You can have enhancement of the 4G, and the 4G is way more spread around than that today. So you can use that to expand it and at much faster than putting the fibers in cities. So I think that would go faster. It can really bring the technology so more people can use it. Yeah, but we're still in an early phases of 5G. You know, we are working on it, and together we're gonna improve it, but we're not at the top yet.
Thank you, Aline. Okay, so we are running out of time, so thank you very much to the three.